Welcome back, everybody, to A Moment with Joyce. And this is our community corner. I am so excited to have my guest here with me on today. She is a wife and she's a mother. She is a doctor at Savannah Riverside in Aiken, South Carolina. And she's a graduate of Spelman College. And I believe that she is a member of the Alpha Kappa Alpha sorority. Y'all help me welcome someone who is very dear to me and a special woman of God, Dr. Monica Manigo-Johnson. How you
Hello.
doing?
I'm doing well. I'm doing well. Thanks for having me on tonight.
I feel so blessed having you. I don't know, it's just always about the name doctor or something like that. Say, I know a doctor.
Well, there you go.
I know a doctor, y'all.
There you go. There you go.
But thank you so much for agreeing to come on the show.
You're
Um,
welcome.
oh gosh. Now, I have some questions that I wanted to ask you since this is the first time that we are premiering our community corner. And
Okay.
what it is just that we just want to keep people informed about what's going on around us in our community, sometimes in our nation, around the world. And right now, we are in a pandemic, is to no surprise to everybody. In March, we came to our lives as we knew it, came to a screeching halt. And so then, I mean, I think we were so in a panic as to what to do with COVID-19. We had never dealt with anything like this before. And so now from March to November,
Mhm.
what don't we know? Well, what do we know that we didn't know in March?
Well, I think back in March, we didn't realize that this pandemic would be going on as long as it has. So it was a novel virus to us. So none of us had ever experienced the virus in the manner in which it swept through our nation. Back in March, we were thinking because it's a form of the common cold. It's very it's the same type of virus that causes the common cold. We kind of thought that folks would get it and it would go away once the seasons changed. Things would get better. But what we now know is that this virus is very difficult to treat. So we didn't realize back in March when the numbers were going initially through the roof, and the treatment mechanisms that would handle the virus the best. So I think we had a lot of deaths early on because we didn't realize what we would have to do, the changes we would have to make, especially in the hospital settings, in the ICU settings, with people who had pre-existing conditions, how it would affect those individuals. And those are the individuals that unfortunately succumb to the virus. So we now know that we can treat individuals with certain medications that have been approved. We can treat them with steroids. We're treating some folks don't have to necessarily be on the ventilator, but there are other mechanisms in the hospitals if you happen to be such that you cannot handle the symptoms at home, that you have to be hospitalized. There are certain modalities that we're using on the floors and in the units to help your lungs to maintain the ability to function. We do know that this virus is particularly difficult to treat because you can be asymptomatic. And so what we're finding is that a lot of people are surprised when they do receive their positive results, that they're just simply shocked and in disbelief. And a lot of people, because of that, they are not adhering to the guidelines that the CDC has set apart. We know that this is a respiratory a virus that is easily caught from droplets from one person to another. So the best and the easiest thing to do would be for everyone to wear a mask. If you wear a mask, it protects others from getting respiratory droplets from you, especially if you're an asymptomatic patient. It protects it's your brother's keeper. If you think about it like that, you wear a mask to protect others. If everyone would do that, we would see the disease decrease in our communities. Unfortunately, we are, as you said, we've gone from March to November, and now we're in the midst of flu season, which is another disease that kills thousands of individuals every year. The symptoms overlap. So, in terms of, you may have a fever, you may have chills, you may have body aches, you may feel extremely tired, you may lose your sense of taste, your sense of smell, or you may have none of that and still be positive. So it's best to do the things that you can do. Cover your nose, your mouth when you're out. Your mask should be worn here, not here, because it does no good if you are not covering the orifices that can actually get the respiratory droplets, and of course face shields. So you want to protect the eyes as well, because you can get respiratory droplets if someone is singing or coughing or sneezing or just talking loud, and droplets float in the air. They can land anywhere. It's free game once they hit the air. So that's why you want to be protected. You want to make sure you're washing your hands. Just every time you think about it, keep hand sanitizer with you. That's the next best thing to soap and water. But we would like for you to, just make a habit of, every 20 minutes or every hour, just wash your hands, keep them clean, keep your spaces clean. If you happen to still be working in an office environment, and you may happen to share equipment, so desks, phones, doorknobs, light switches, any of those common things that you touch several times a day, make sure you clean those daily at the start of your day and at the end of your day. Because
I'm glad you said that, because at work, I think we have gotten a little laxed with that, especially answering each other's phones.
especially answering each other's phones, touching each other's workspace,
Mhm.
sharing pins, sharing anything that you can doodle with that you may have gotten some droplets on that can be passed on. Those areas especially need to be clean.
Okay. Let me ask you a question about mask. Uh, because now a lot of people are finding ways to make their own mask.
Mhm.
So I guess the question I'm trying to ask is, because like you said, I've seen some who wear it under their nose, and
Right.
but when is a mask? I guess I want to ask, is not safe if you make it at home? Is it a such thing as a mask not being safe if you make your own?
So if you make your own mask, just make it such that, and you can actually go to the CDC website, and it will give you, at one point I saw on there, and it's probably still on there, the dimensions and the thickness for which your mask needs to be, the multi-layer, and the best material to use. So you want it such that the droplets cannot actually get through. So if I were to make one at home, I would probably make more than one layer, 2 to 3 layers. I don't sew, but imagine that I could. I would do 2 to 3 layers of a silk kind of material, or a cotton, something that's breathable. You
Okay.
do not want something that you are not going to be able to breathe in,
I've had a
because
few.
because we've had individuals get into problems where they can't breathe, and then if you can't breathe, then you either continue to wear it and get into respiratory difficulty, or you simply take it off and you expose yourself more to the virus. So there's lots of masks on the market that you can get, but make sure it's one that you can breathe in, and that it's a comfortable fit, that it's not sliding down, that it's adjustable so that it's comfortable for you. And as long as you're going to be within 6 feet of other individuals, you need to have your mask on. If you happen to work in an office where you can close your door, or you're in your vehicle alone, or you're in a space where you're able to stay 6 feet apart during the day, then you might not necessarily need to don your mask at that time. But any time that you're going to be in a tight space, you should wear your mask. And because you never know who you may be coming into close contact with. I think the CDC's now revise and they update their webpage daily. So some revisions as we've gotten more and more knowledge about the disease, we now know that their close contact definition has now transcended to, if you're within 2 to 3 feet of a particular individual, especially if they are presumed to be positive for 15 minutes or more in a 24-hour period, then you could be at risk. So that's why you want to make sure when you're in 2 to 3 feet of an individual that you're masked. And I know sometimes they say, well, I know that person, that's my friend, that's my something, but you're not around that person every day. You don't go to work with that person. You don't go to the different stores with that person. So, and you don't know who that person comes in contact with. And so that's where, it becomes a little difficult when in terms of something we do call contact tracing, or we have to go back and research all the possible contacts that you've made throughout the day if you happen to be positive. So that's one of the tasks that we also are doing very diligently, because it's difficult now. It's so widespread. Our numbers are climbing. We're over 10 million cases in the United States. We're over 243,000 deaths in the United States. And even just closer to home in Georgia, we are over 400,000 positive cases in our state. And, we're trending toward 9,000 deaths just in Georgia alone. So it's very important that you follow the rules. It's to protect us. Hopefully we have a vaccine on the horizon in terms of providing us some additional protection. Hopefully within a year, we'll be able to have access, community-wide, as the companies make more and more and get it on the market. So that's another layer. But until we get there, we've got to go through flu season. We've got to, get over the hump before we can actually say we have overcome COVID.
Well, I want to touch base on what you mentioned before about friends and those that we are comfortable with. We are coming up, we're only 3 days away from Thanksgiving. And so I want to know about people meeting together, gathering together, because Thanksgiving is important. It is important. It's where we come together, we share with our family and friends, we eat. But now we're in the midst of this pandemic. So what precautions should we take when for those who are thinking about gathering or inviting those others that are inside of their homes?
So I think the recommendation right now is to not gather. I know that this is, probably one of the largest holidays and a time when families get together on a yearly basis. But this year it's particularly tricky because you have family from not only your community, but communities outside of your state. Some may be flying in from other countries. And so that's contacts, that's close contacts that you are bringing into one area. So we know that, we know that the disease will spread closer in closed spaces. The state of Georgia right now still is recommending that gatherings not more than 50 take part, and that's with doing social distancing. Wow. So you have to imagine 50 would be a huge space, not grandma's den where all 20 people sit around, shoulder to shoulder eating, laughing, talking, respiratory droplets
Yeah.
floating all over the air. You're probably not going to be masked, just because you're just comfortable with, those particular family members. So we're just asking, if you can get away with not meeting, maybe do Zoom later on that afternoon, because you just never know. Asymptomatic people still spread the disease, and so you could be talking to your son that's home from college, that's been around all these other people in the dorm, and then you have a relative who may have diabetes or hypertension, or a cancer survivor whose chances of not beating this disease if they catch it are not great. So you want to think about others. You want to not put other people's lives at risk if you can
Wow.
help it. So I think that advisory, they talk about it some on the CDC website. There's a nice, holiday guide where they are encouraging folks to just stay at home, cook at home, keep it small this year in hopes that we can overcome it. And next year we can have a grand event. But you want to be careful. If you're exhibiting any of those symptoms, or if your family members are exhibiting the symptoms, go get tested. Go get tested.
Wow. Thank you. Thank
And
you
if you
so
are
much.
tested, you have to, quarantine and do all those things that your doctor will advise.
Monica. I mean, with this, we can really talk all night and
Mhm.
about this, because it's more serious, I think, than a lot of us are taking it,
Right.
because we're tired of it. I hear that a lot. I'm tired of it. Like it's going to go away just because we're tired of it.
Not- And it's not going away. We thought it would with the warmer weather, and that didn't happen. We saw a huge spike after the 4th of July when everyone gathered 2 weeks after the 4th of July. The numbers went haywire. I think maybe by September they didn't get as high, because I think people realized that, oh, my gathering is actually putting us at risk of actually contracting disease. So I'm hoping that as we go forward and we can get over this winter season, that and more folks, get the vaccine. And it's probably not going to start with, when I say us, the healthy folks. So the companies can only make a certain amount, and they only have a certain amount available. And so it's going to be up to the leadership to decide, who gets it first. Do we do the elderly first? Do we do the healthcare workers first, because they're on the front lines taking care of these individuals? Who do we give the vaccine to first before it freely trickles into the community? So that's the other reason that, you have to make sure that you are just following the guidelines as best as you can. I know we're tired. We're tired of being locked down, not being able to go to the movies, not being able to go to the restaurants and things of that nature. But, it's a sacrifice. It's the sacrifice that we all have to make so that our country can get better and we can get back to the way that we used to be.
Wow. Thank you so much. Thank you for talking with
You're welcome.
me. Thank you for informing us. Thank you for, I know for myself, making it just kind of refreshing everything for me, especially about the work part. It really hit me about work. But we
Yes.
want to thank you so much for coming up on the show, agreeing to come and informing us. And I'm sure we are going to have you again if you would like to come back and sit
Sure.
with.
I'll come back.
Okay, guys, we'll be right back. Stay locked in.